ultimately regulation legislation is in place to improve safety, to improve patient outcomes, etc. Now, you mentioned AI there, and you mentioned tech, etc. And we previously mentioned that the burden may become too great for people to both provide care and to remain compliant. But how I see this is that I think that compliance should be integrated into your organization, not a separate thing that is bolted onto the side. When Safe Workplace looked at this, we looked at various elements of how we could support the healthcare sector. And yes, reporting and risk management are a fundamental part of that. But what we looked at instead was, or in conjunction with this, was what are the requirements? What do we need to do to be compliant? So what we're advocating is that you would use AI to break down your obligations so that you would be able to answer the question as to how can I be compliant? So you need to find out first what you need to do. So we have developed a system basically where we will identify your compliance requirements, and then in train with that, we will track those tasks as they are completed. And ultimately, we would hope give you a clear picture on a day-to-day basis of how compliant your organization is. So yes, I think healthcare organizations are undoubtedly going to have to use tech to do this, because time and human resources simply won't allow you to keep up to date with what you need to do.